Welcome to the Health Made Easy podcast. Health advice so easy, you'll feel more confident about your body, health, and life. And now, your host, Dr. Connie Jean.
Hi, it's Dr. Connie. So as someone who lives with a chronic disease, I'm always weary of taking medications. And if I wasn't as aware of the truths behind the prescription medications, I'd be a lot less concerned. However, I'm happy to report that I'm meeting more and more like-minded clients and patients who are preferring the natural healing approach, as opposed to using meds to perpetuate or exacerbate their conditions. As a clinician, I'm seeing more clients who are exhibiting a common thread of symptoms, including weight gain, brain fog, severe fatigue, digestive issues, swallowing issues, all over body aches, and weakness. For the last few weeks, I've been talking a lot about the importance of our microbiome, but the more I read, the more I find that our microbiome may be the ultimate culprit. So let's talk a little bit about the antibiotic crises. Antibiotics saves lives. There's no question about it. However, we're now finding that they're grossly overprescribed today, and their implications on our health are pretty scary. So the problem. The antibiotics are overused worldwide, and according to the CDC, 69% of United States children under the age of 2 years old experienced ear infections and strep throat, and by 18 years old, they will have taken 10 to 20 full courses of antibiotics. And because many women are especially prone to UTIs, by the time we're 30 years old, a typical woman would have had 30 rounds of antibiotics. And according to the CDC and other official reports, at least 50 to 75% of antibiotic prescription is unnecessary and inappropriate. For example, a doctor will prescribe an antibiotic to do something in that short visit time if you go to see the doctor, even if it's a viral infection, which we know antibiotics don't work for. Antibiotics are not just prescribed, but are rampant in our non-organic animal products as well. Animal feedlots that are highly unsanitary use antibiotics not only to treat infections, but to make more profit as using antibiotics to fatten up the animals, which does so by about 15%. Also, evidence suggests that even the organic fruits can be contaminated by antibiotics. We know that simply washing those fruits and vegetables does not fully remove the pesticides and antibiotics. They have penetrated the skin into the pulp. Antibiotic is wreaking havoc on our health. And antibiotic reactions are also very common. They're responsible for approximately 140,000 hospital visits a year in the United States alone. They're the most common drug reaction in kids under 18 years old. We also know that antibiotic resistance is a global health threat. The Zika and Ebola epidemics do not even come close to competing with the antibiotic resistance. And antibiotic resistance is a direct result of inappropriate prescription by our doctors and overuse in the meat and dairy industry. So let's talk a little bit about the microbiome. It's not just that we become resistant, but our bacteria in our gut itself becomes highly resistant to the antibiotics. The resistant bacteria are capable of mutating, and the interplay between our genes and their genes creates a problem in epidemic proportions. And according to the CDC, approximately 2 million Americans are resistant to antibiotics, and at least 20,000 people die every year due to antibiotic resistance. Global Health declares that this is by far the largest global health threat today. So antibiotics and weight gain. Remember the blog from last week on the microbiome. So if you consider the antibiotics given to the cattle is to fatten them up by up to 15%, how does that translate to us? If you're struggling with weight gain and despite your efforts to eat healthy and exercise, it may be due to the dysbiosis, which means that you have an imbalance of good and the bad bacteria. The bad bacteria holds on to the toxins that reside in your fat cells and further creates an inflammatory response in such a way to cause weight gain despite your efforts. Also, your mutagenic genes with the bacterial genes adds to this toxic pool, causing your body to be at a metabolic disadvantage. And again, antibiotics and chronic disease. This is a huge issue. As a chronic illness patient, I'm always questioning how and whys of my personal health. I've had my share of antibiotic use from when I was a young girl. Antibiotics back when I was living in Korea were considered a miracle drug. So they were given out like candy for just about any little medical concern. We now know that the antibiotic use can cause chronic disease. This is because they kill off all the good bacteria in our gut, and when you're given antibiotics at a young age, those good guys never fully recover. So good gut flora, collectively called the microbiome, can affect our weight, our mood, hormones, our immune system, and our ability to detoxify. So if antibiotics are causing our body to shift negatively into an acidic state, we've got a huge health crisis on our hands. And at the onset of my lupus diagnosis, the doctor scrambled to provide me with multiple antibiotics just to try without knowing exactly what was causing my mysterious fevers, pain, and tachycardia, which they assumed it was an infection. As I mentioned, damage to our microbiome can cause obesity, autoimmune disease, anxiety, brain fog, diabetes, heart disease, asthma, Crohn's, and IBS, just to name a few diseases. It's implied in just about any chronic disease. So why are antibiotics overprescribed? Well, according to the CDC, here are the top 4 reasons. Number 1 is that doctors think patients expect antibiotic prescription, and because of this, 50 to 80% of antibiotics are overprescribed. Number 2 is that doctors are scared to be sued if they missed an infection, so it's to cover their liability. Number 3, because the doctors don't have time to explain the risks to the patients, and with patients overbooked and overwhelmed, doctors find it easier to prescribe a solution than taking the time to dig deeper into their patients' problems. Number 4 is that doctors aren't knowledgeable about the alternative solutions like herbs and holistic practices. So what can you do to protect your health? Well, number 1 is adopt a healthy, alkaline way of eating by incorporating vegetables, lots of vegetables in all colors of the rainbow. Take a probiotic and supplement with a good multivitamin to span good nutrients to prevent getting sick. Number 2 is to incorporate adequate protein to fight infections, or eat organic meats, eggs, nuts, and seeds, and eat some at every meal because we need protein for our immune system to fend off the bacteria. Number 3 is avoid processed foods and sugary foods as they further work to amplify the bad bug problem. Number 4 is to take natural supplements to boost your immune system. And number 5 is to take a good quality probiotic, especially those loaded with variety of strains like lactobacillus, saccharomyces, and bifidobacterium. And take especially during flu and cold season and rotate the brands every 3 months. Number 6, take immunoglobulins and L-glutamine to help to heal your gut permeability. Number 7 is to consume prebiotics, also to feed the good probiotics. Jerusalem artichokes, burdock roots, sweet potatoes, garlic, onions, all vegetables are good options. Some of the herbal remedies are available to you to fight your infection rather than resorting to the antibiotics. But first, there are some herbal safety considerations. So if you have an immune disorder or are pregnant, please consult with your healthcare provider. And if you experience persisting symptoms, including a cough, fever, difficulty breathing, headaches, back pain or neck pain, abdominal pain, or vomiting that lasts more than a week, then please seek medical treatment as soon as possible. So here's top 7 immune boosting herbs to treat common infections like cold and flu. I recommend following the dosing on the product label unless otherwise specified. Number 1 is Andrographis. It's an amazing herb for preventing and treatment of colds, viral, sore throat, and sinus infections. Andrographis and Siberian ginseng combined is especially helpful for treating colds, especially if treatment is initiated within 72 hours of the onset of symptoms. And if you're pregnant, please avoid it, and it's generally safe for children. Number 2 is elderberry. It's been researched and is considered effective in treating flu in both adults and children. It's also most effective if initiated within 2 days of onset of symptoms. Number 3 is Echinacea. It is mostly effective for cold prevention and recurring infections, so it's a good idea to dose up throughout the cold and flu season. Number 4 is an herb I can't pronounce very well. It's called Caloabo or Pelargonium. It's also known to be effective in shortening the duration of colds, bronchitis, and sinus infections. Number 5 is ginger, which effectively fends off viral infections as well as to ease digestive symptoms combined with fever, cold, and flu. With its pungent taste and smell, it breaks up the congestion very effectively. It's my favorite when boiled with lemon and local honey. It's very soothing and healing. Number 6 is garlic, which is a strong herb that can help your body fight viral and bacterial infections. Use abundantly in your diet by incorporating it in stir-fried vegetables, soups, and salad dressings, or make a garlic tea. In the winter, I cut the whole garlic in half and roast in the oven for 5 to 7 minutes and use it as a spread on my gluten-free bread or celery with the extra virgin olive oil. It's so tasty. Number 7 is maitake mushrooms, which are also great for supporting our immune system and especially for upper respiratory infections. We have professional quality herbals available for you on our site, and the site link is below. Thank you so much for joining me today. Let's do our part in creating our own health. I'd love to hear from you, so please comment below or subscribe to our YouTube podcast, or like us on Facebook page to stay in the loop. See you next week.
Thanks for listening to the Health Made Easy podcast. www.drconniejean.com